And Wockhardt has received a significant boost with the European Medicines Agency fast-tracking its key antibacterial candidate, Zaynich. The drug targets severe drug-resistant bacterial infections, but I don't know there is anybody in the business newspaper who doesn't know about Zaynich, to be honest. Dr. Habil Khorakiwala, founder, chairman, Wockhardt Group, Johnson, to take this conversation forward. Dr. Khorakiwala, thanks so much for joining in. You know, we ended the last segment saying that there isn't a foot that Wockhardt can put wrong, it seems, and 2025 has been one such year. So congrats on this European fast tracking as well. What does this mean? What is the earliest launch timeline in Europe for Zaynich?
Thank you very much, and let me wish you and your viewers good morning and happy New Year in 2026. Now, this is accelerated approval process in Europe, and normally they would take another 6-7 months to approve the product. So we should expect in some time middle of the year or July-August period the approval of and actually, this is much faster than we had anticipated approval process in Europe, because I think, and they have given this consideration mainly because of the extensive problem Europe is having of multi-drug resistance, and nearly more than 200,000 patients are there. And therefore, the urgency and saving lives have become very important. And that is why we have received this approval. What is also important that we are likely to get for all indication, a hep web, bloodstream infection, stomach infection, urinary tract infection. For all infection, we are likely to get the indication approved. So the potential would be significant in Europe also.
Khorakiwala, good morning. This is Hiral on this side, wishing you a happy new year as well. So basically, we were looking at a potential launch of mid-2026 when it comes to the US markets. India as well as early as mid-2026 is what we were eyeing. With Europe coming into the kitty, is it possible that all the three regions will have a mid-2026 launch? And if so, what's the revenue potential that you're seeing in FY27 as a year?
Actually, you know, when we receive approval, there are also a process for a new molecule to get access to the hospital all over the world. And therefore, it would be this revenue would be like a hockey curve. Initially, it will take a little slow start for next 12, 18 months, and then it will accelerate significantly.
In which case, Dr. Khorakiwala, the presumption would be till FY28, it will be a slowish kind of performance, and then it peaks up. Would that be a fair assessment?
Yeah, 28 would be a beginning of the acceptance of the molecule. Thereafter, it will accelerate very significantly.
Got it. So just help us understand, because the timelines are stretched relative to what equity markets usually work with. What is the peak sales potential for something like this in Europe? And would there be competition coming in at some point of time in FY29, FY30, and therefore trying to ascertain what benefits come into Wockhardt from Europe?
You see, Wockhardt Europe with about 500 million patient pool has a potential, we believe, around $400 to $500 million at the peak. And we do not believe that there is any drug in the pipeline which will come as a competition to Zaynich for several years.
So for several years, you're not expecting any competition to come in. What is the pricing looking like, and have you already started conversations in terms of pricing and reimbursements in the European region as well?
That will only come after once we receive approval.
Okay.
And thereafter, we will have to get the price approval in Europe. In Germany, you can market immediately, and within 6 months, they will give you a price approval. And you can decide on the price early. Whereas in UK, they have a very special provision because of the urgency and importance of life-saving nature of Zaynich. They give you a loan firm commitment for 2 to 3 years, up to £20 million, irrespective what is the sale. and then we have to supply the drug within this revenue, whether you supply full value of a drug or part value of the drug, but the government will, NHS will pay you the agreed amount. And this process takes about 3 to 6 months after the product approval.
Okay, so timelines and approvals is going to be key from here on with regards to launch as well, and that will give us an idea of what could be expected from pricing perspective and the kind of sales that can be generated. But thank you, Dr. Khorakiwala, so much for joining us on the show. It's always a pleasure to speak to you, and I think a detailed conversation with regards to what is the other pipeline going to look like after a Zaynich is going to be key, because this is one of the firsts for Indian company as well.